like we have a pretty full house, so we will get started this evening. You are here for the Finding Financial Resource session. Tonight's session will last about 50 minutes, so we will be ending around 7:50 p.m. Eastern Standard Time. And we are honored tonight to be joined by my friend and colleague, the fabulous Allison Harrison, who will be presenting the information this evening. And before we begin, we want to just thank the sponsors of Symposium. Without their support, none of this would be possible. So we really thank them for their generosity. Just a couple reminders before we get going. Your cameras and your microphones will be off for the entire session, but we are going to try to leave some time at the end for question and answer. If you do have questions, please enter them into the Q&A box in the toolbar on your Zoom, and we will be sure to get those questions answered for you. If you have any technical difficulties throughout the session, you can enter your questions or comments into the chat about any difficulties, or you can visit the Slack environment and use hashtag helpdesk in that Slack environment, and somebody can assist you there. I think that's all of the little tips and tricks, and we can get going for this evening. So I will welcome in Allison, and it's all yours, Allison.
Thanks so much, Janet. Always a pleasure to work with you, even when we're just online. Hopefully you all can see my screen. I'm Allison. I am the Associate Director of Services here at HFA. I oversee the services team, which runs our Helping Hands program and our Helping Forward program. I have a master's in social work, and I'm also a certified financial social worker. And I just want to say up here at the top that I'm going to be talking about many different programs and resources. We're not endorsing any of them except for HFA Services, which I fully endorse. And we're also not trying to provide financial advice. So we tonight are sharing tips and resources that we have found helpful based on what we've observed about the needs and the experiences of the bleeding disorders community. So I'm going to be doing a lot of talking tonight, and so I actually want to start by hearing your voices in the form of answering some poll questions. So I'm going to launch a poll. There are, I think, 7 questions. So you should see a poll pop up on your Zoom screen. I would thank you very much for participating so I can learn more about you, what you're most interested in learning about today, who you are in terms of your relationship to the community as you come to this session, and then just maybe a fun question and maybe a little pre-quiz question. I'll give you a few minutes to answer these questions. And right now it says 0% have participated. Please let me know if you're not seeing the questions. So far, we have a couple votes for Bart Simpson as the favorite character. Just saying, in case that influences your votes. Olaf from Frozen has taken a strong lead here in the poll. Okay, we got our first votes for Baby Yoda. I'm a big fan. I know this may not be the most important poll question to you, but I think it's really fun, so that's the one I'm looking at first. Ooh, and now it's Winnie the Pooh and Olaf tied for the lead. Oh, this is an unpredictable contest here. Oh, and we got a Grogu and Bart Simpson tied for second. Gonna need some additional votes to be cast. Let's see, right now we have 75% of you have participated. Can I get a few more votes to break this? We have a two-way tie for first, Winnie the Pooh and Olaf, and a two-way tie for last, Baby Yoda and Bart Simpson. So just a few more votes. And if you're just joining, you should be seeing a poll on your screen. I'm hoping to hear your voices up front. It will help me know how to focus some of my information, because I have a lot of information to share and I want to make sure to cover what's most relevant for you. I see that some votes are still coming in, but I'm going to go ahead and start looking through some of these results. I see that, let's see, the topic of most interest is Helping Hands financial assistance programs, followed by how to find help for a specific bill. And then red flags is third. It looks like we are pretty much a third with who's here, a person with a bleeding disorder, a family member, or a helping professional. So that's good to know. Again, if you are still working on the poll, feel free to keep adding in your answers. I haven't closed it yet. 78% of folks do not currently need assistance to pay a bill. 13% of you don't or do. 9% of you don't right now, but have recently. Thank you for sharing that. Okay, I'm going to end the poll and you'll be able to see my results as well. I'll let you know the answers to these first few. A drum roll for the favorite character question. Our winner is Winnie the Pooh. Classic choice, everyone. Classic choice. 41% of you said that Winnie the Pooh is your favorite character, followed by Olaf from Frozen, a modern favorite. And then we still have a tie between Bart Simpson and Baby Yoda. That is fascinating to me. Fascinating. Thank you. We have a pre-quiz here with the last couple questions. Can I self-refer to HFA's emergency assistance program? The answer is no. So 59% of you got that one correct. We take referrals from eligible referrers. I'll talk a little bit more about that. Can HFA help pay my medical bills? Oh, this one was close. The answer is no. HFA does not cover medical bills through our financial assistance programs, but I will be pointing you in the direction of some organizations that do. And this was a multiple choice question, and the answer is that all of these are real hotlines that you can call. And don't worry, this isn't the only place you'll see them. I will show you where to find all of these numbers if you want to call any of these hotlines in the future. All right, well, thank you again for sharing your voices with me. That helps me. As I'm going through, if you think of questions, please put them in the Q&A. I'm going to leave time at the end. I'm going to do a demonstration to walk through how I would look for resources. But first, let's just jump in. I'll give you some overviews about some financial assistance programs. And I'll start with Helping Hands, which was founded in 1997. And it actually started as a program to provide relief to families who were dealing with the impacts of the HIV and hepatitis crises. And it has evolved over the years to meet many different types of needs of the bleeding disorders community, to serve as a safety net for families facing financial hardship, and also to provide resources to help promote people's self-sufficiency. So helping you know where to go to find the information and help that you need. And just to give you a sense of what we've been up to, in 2020, we processed 1,000 referrals. We funded 878 applications, and we distributed around $525,000 to community members in need. That included our COVID-19 relief program and a really big increase in need from what we usually see in a typical year. An overview of our programs. So when people hear Helping Hands, I think most of you are probably thinking about our emergency assistance program, which is the program we process the most referrals for. But we also have an items assistance program, an inhibitor support program, we have a disaster relief program, and we have had a COVID-19 relief program, which as of November 1st, we will not be processing any more referrals for COVID relief. So wanted you all to have a heads up about that. We've distributed $525,000 in assistance through COVID relief since we began that program late last March, and are really pleased and grateful for all the folks who donated and the grants that we've received to be able to run that program for so long. So we also have our patient assistance portal, which I'm gonna guide you through today, and our Helping Forward program. Our Helping Forward program is to help empower community members through career planning and financial planning. And our patient assistance portal, will just wait and see. You'll learn a lot about that. A great place to go if you are not sure which program would meet your needs is to our landing page. And my trusty colleagues will be putting links in the chat box. So feel free to save those. Although again, not the only time you'll see these links. We have this handy overview chart that lives on our Helping Hands landing page that'll give you a quick comparison between programs. All of our programs are open to applicants who have a diagnosed bleeding disorder or live in the same household as someone with a bleeding disorder. The eligible diagnoses are listed on our website, and Megan will put a link in the chat to that list in case you're curious about maybe a more rare bleeding disorder and whether we cover it. And each program has its own landing page with probably more details than you need to help answer your questions. Let me just give you a quick overview of these programs. So emergency assistance can cover housing, utilities, or transportation. So by utilities, we mean electric, water, natural gas. By transportation, we mean a car payment, sometimes car repairs. And for this type of application, you can only apply once per 365 days, whether you were approved or denied last time you applied. We do require an eligible referrer to submit that referral form for you. And the reason for that is twofold. One, when a professional puts in a referral for you, they're saying that they are verifying that you have a bleeding disorder and what your diagnosis is, and that they've heard from you that you're going through a certain situation. That means that, one, we don't have to spend more of your time getting extra documentation to verify your bleeding disorder. We can just call you as soon as possible and help you. And second, it lets us know that you're connected with someone locally who knows what you're going through. And we think that's really important for anyone facing financial hardship, that they'll be able to direct you to additional local resources that we might not know about because we're a national organization. So that's why we ask for the professional referral. Emergency assistance is the only program that goes through a committee, and all applications are anonymous when they go to the committee. So that's a little overview about emergency assistance. I didn't mention this before, but we only pay directly towards the bill. So if you're approved for assistance through Helping Hands, we're going to make a payment directly to the electric company or the landlord or purchasing the item, unless there's a reimbursement situation, which we can do with items and inhibitors. So items, this is one of my favorite pictures that HFA has. Our items program is to help you with medically recommended items that will help in prevention or treatment or protection for your bleeding disorder. So this little kid's wearing a comfy cap and some knee pads. Those are protective gear that if you couldn't afford out of pocket, we could help with those. We help with wheelchair needs, braces, orthotics, reusable cooling units, so you're not spending $100 on ice packs every month. You can submit this referral yourself or be referred by someone, and we just have a simple form that we need a healthcare professional to complete. And if you purchased it out of pocket, but you're really in financial difficulty and you need reimbursement, that's an option for this, and you can apply throughout the year. Our inhibitor support program is for people who have an active inhibitor, and we can assist with medical travel or educational support. So we know that people with inhibitors sometimes have to travel to their healthcare clinic a lot. Sometimes that can be hours away, so we can assist with those costs. Or if you miss school, your child misses school and needs a tutor or some special education supplies to help them catch up, we can help cover those as well. Again, we have really easy to fill out forms that are online, and this program you can also apply throughout the year. Disaster relief, I think, is pretty self-explanatory. We have distributed around $16,000 in disaster relief this year from people who were impacted by hurricanes, winter storms, last year wildfires. So we try to keep this program as flexible as possible and just meet the immediate needs of folks with the bleeding disorder and their families who need assistance, whether it's temporary shelter that their insurance is not going to cover, or money to replace their basic household, clothes, shoes, until they get back on their feet. So I'm going through these fast because we have a lot of information to cover, but we can definitely talk more if you have specific questions. So just to give you the framework of how an application works with Helping Hands, we get the referral, it flows into our database, we see if you're eligible. I'm going to say, oh, Janet hasn't applied for emergency assistance in the past 365 days. This request is for electricity. She's eligible to apply. I'll call her. I'll complete an application for her, submit it to a committee. If it's for a different program, then I, as a staff person, could make that decision myself. I let her know what the decision is. We get the documentation we need. We make that payment. And then for every person who applies, we are sending a custom email or text message with resources that are going to help them in case they need additional help in the future, whether that's financial help or education and support. So I'm going to tell Janet, I think you'd be really interested in our Blood Sisterhood program. Here's a link for signing up. You could really get some support from other women who have similar experience as you. Also, here's the number for our mental health text line, a mental health text line that you might need. I know financial issues can bring up a lot of mental health stress, so save this number in case you need it. So again, on the same line as providing resources, we keep some, I think, very robust resource guides on our website. The link is here. We update these several times a year, and most of them are in both English and Spanish. And you can navigate these. They're all hyperlinked, and they have different categories. And I really want to recommend that you all take a look at the financial assistance resource guide. And I'm actually going to show you some of the highlights from that. So this is what it looks like. The very first thing is key resources. And I'm going to tell you about some of those key resources. So here are 4 things that we share with almost everybody. One is findhelp.org. This is a database where you can do a search with your zip code, and it's going to turn up all kinds of resources. Some of them are national programs. Some of them are just for your area, just for your city. Some of them are from churches. Some of them are government resources. Just a huge variety of resources, and you can sort by, food, utilities, job resources, housing. So that's one great kind of self-guided search you can do online. We also send everyone to call or look up 211. Most places in the country, you can just dial 211 on your phone, and you'll be connected to someone who works for the United Way hotline in your area. And they can also help you navigate local resources. And it also is available in several languages and is a free resource. So I'll be showing you that in my demonstration as well. The Patient Advocate Foundation has 2 wonderful resources. One is a financial resource directory. And the way you enter that search is by starting with your age and your diagnosis, because they have gone through all kinds of financial assistance programs and looked up eligibility. And so if you have a specific diagnosis, it could be your bleeding disorder, but maybe you also have diabetes, or maybe you also have a cardiac issue. You can put those in and you'll find results that are tailored to your diagnoses as well as more general resources that fit your demographic information. I will walk you through that one as well. They also have a brand new, just in the past couple weeks, rare disease care line. And now this is a great resource because you'll be connected with someone who can help be more of a case manager for you. We at Helping Hands, we are spending most of our days doing applications, providing financial assistance, pointing people in the right direction. We can't necessarily serve as a case manager for every person we talk to. These folks can spend more time with you on the phone to say, well, have you tried this? Have you tried that? I would really recommend you call this. They can help you problem solve insurance situations and Medicaid, Medicare situations. So that's a great number to know. They also can provide translation as well, if you know someone who needs that. Last on this slide, Financial Resilience Center is a website that is geared towards people with disabilities. So whether you self-identify as having a disability or not, it is, I think, a really wonderful resource. A lot of good education around money management, around how to look for ways to increase your income, how to understand more about benefits programs from the government. So a really great resource to check out. And lastly, I'll say, we all have local resources. It's called something different almost everywhere. Sometimes it's your county assistance office, social services, a public welfare office, usually run by a department like Health and Human Services. And I would recommend that you find out how to get in touch with that agency. If you don't know, you can ask, at your community center. I know that sometimes these government offices can be short-staffed, which is unfortunate, but I do recommend that as a place to start locally. Government benefits, you all indicated that this was not as much of a priority of a topic for me to cover. So I'm just going to really go through it quickly and point out that if you are curious what benefits you might be eligible for, there is a benefits checker on benefits.gov, and you can answer the questions and it'll tell you what you might be eligible for. I also want to point out for health insurance, it's a great time to check if you are eligible for health insurance coverage if you do not currently have coverage. So healthcare.gov is the place you want to go, and don't be alarmed by the sticker prices. Stay with it, walk through the questions that they ask of you online. You may be eligible for certain subsidies or even government-sponsored health insurance. Sorry, I keep clicking my buttons. I apologize. Grants, there are, besides HFA's financial assistance programs, there are grant programs available for people with bleeding disorders. I want to point out one specifically. Since we're going to be sunsetting the COVID relief program, you might want to know about the National Organization for Rare Disease, NORD. They have a COVID-19 assistance program that you might want to check out. Other grant programs include Colburn-Keenan, Coalition for Hemophilia B, Hope for Hemophilia, and others. And then I did see that many of you were interested in this topic, and I'm really glad, because I know that when you have a bill in your hand or you have people calling you trying to collect on your bill and you're running out of time and you don't have money in your bank account, you don't have credit cards or they're maxed out, it's really tempting to look at some of these these offers that may not be as good as they seem. First, just some common scams and fraud to know about. Nowadays, you're more likely to get a spam phone call to your cell phone or to a text message, as well as a landline, a robocall, someone saying that you've won something. They've gotten smarter and smarter. I feel like when I was younger, it was like, oh yeah, that's a spammer. Now I get text messages and I'm like, wait, is that really from AT&T? I'm not sure. If you're not sure, don't click on it. Don't give anyone your information. Call AT&T and find out yourself if you really want a gift card. Not worth giving up any personal information. Be wary of free trials as well. Also be wary of anything that's about COVID-19 relief. I am really sorry to say that people have taken advantage of the pandemic to say that they can help you if you give them certain information. Be very wary, double check everything. And then these two that I've put on the screen, title loans and payday loans, we actually see quite a few people who have gone this route and end up really stressed over the terms of these types of loans. So title loans sound really promising. I own my car. I don't have money in my bank account. I'll take a loan out on the title of my car and I can pay this bill. What happens is if you don't pay back the loan on time, every time, they can repossess your car. They own the title to your car. They also are going to charge you a lot of interest. So maybe you were able to pay that bill immediately, but now you owe them the amount of the loan plus 25%, plus 50%. It can become a really dangerous, escalated situation very quickly, and you're risking losing your vehicle. Payday loans, also really tempting. Some states have actually passed legislation to regulate these because they have gotten a lot of people into financial difficulty. A payday loan is usually a short-term loan for $500 or less that is due when you get paid next. Again, they're going to charge you a lot of interest. You're basically paying more for the money you're getting. You're paying more money than the money you're getting because you're paying interest on it. So just want to point out these two red flags that a lot of people end up, finding appealing, and I understand that. A good resource if you are concerned about whether a loan or an offer you're getting is legit is the Consumer Financial Protection Bureau. I know I'm a geek, but I love the Consumer Financial Protection Bureau, and they have actually really good resources on their website. So I'd encourage you to look there if you are worried or considering, taking out a certain kind of loan or credit card or anything. I just want to mention, again, our Helping Forward program. We know that getting financial assistance is just one piece of the puzzle. And there are a lot of other pieces of the puzzle, including being able to have financial health, financial education, knowledge about how to manage your money. There's also your income side and being able to get the kind of job that you need to be physically and financially sustainable. So that's what we're trying to address through our Helping Forward program. The link is here. Would encourage you to check it out. So now I want to actually do some demonstrations. So let me stop sharing my screen. So I'm looking in the Q&A and in the chat. I would love to hear from you if there's a certain type of bill or situation that you want me to use as an example as I walk you through some of these resources. And thank you all for your contributions to the chat. All right, I'm going to go ahead and walk through. So I'm going to use the example of copay medical bills. Thank you. Okay, so I'm going to use the example of copays and medical bills. So I'm going to say that I need help with my medical bills. I'm on HFA's patient assistance portal. I think this might be a good place to start. It can be really overwhelming to know where to start. I like to start here, partly because I put it together. So I'm a little biased. But you still see the slide. So I'm here on the patient assistance portal on HFA's website. I just want to show you what it looks like. Each of these red buttons is a different resource. As you can see, there are many of them, partly because we offer them in 2 different languages. But the very first one is financial assistance, which is what we're talking about today. This is a PDF, and the great thing is that it's hyperlinked. It also, if you click this button, shows you the outline here on the left, where you can click through. So I need help with copays. Look, there's a section, insurance, copays, deductibles, premiums, and other help. I click that. And here's a whole section of resources. So, I might open some of these links, see which ones apply to my situation. For example, here's one that has copay assistance for my portion of prescription medication costs. Maybe that's what I need. So I can check out this. We have the link, we have the phone number. It helps you get to exactly where you need to go on there. Maybe, and that was my bad, those links are supposed to open in a new tab. PAN is one that can cover up to $2,900 a year for co-payments. Again, we have the link. We try to put the link to the most specific page possible. So when you open it, you land right on the hemophilia page for PAN. And look, they've increased their assistance amount. We're actually about to update this one again. So this is a good place to start if you want to start here. Another place you can start is this National Financial Resource Directory I told you about through Patient Advocate. So I'm going to say that I am insured, I have copays, but maybe I'm underinsured. So I'm going to say I'm 46 to 64. I'm going to say that I live in North Carolina. There's no bleeding disorder specific diagnosis here, but there is rare disease. So I'm going to click rare disease, and I'm going to say, they have so many insurance policy options, medical bills. Here's one, medical bills. So this is just an example of a search. And then you can go through, I love this feature, you can uncheck and check ones. So I'm not an actor, the Actors Fund does not apply to me, so I uncheck that one. I'm also not a ball player, but I keep reading through, and some of these others might apply to me. And when I'm done, I can go down here and either print the results or email them to myself. So, clearly I'm not going to be able to call all of these places right now, but I can email it to myself, work through them as I have time. Same thing, 211. Let's say I am looking for healthcare expenses. Look, healthcare expenses in the box on 211.org. I'm not having an emergency. I do need to, let's say, pay for prescriptions. So it gives me a couple of options there. I can also say that I want to look up my local 211. I would recommend that. I'm going to put in a zip code, and look, I can go to my state-specific 211 information. That way, if there are any North Carolina resources, I can find out about those. Healthcare. Again, looking for financial resources can be tedious. I know it can. Take it one step at a time. And again, there are hotlines. There's hotlines that I recommended that can help you navigate some of these if you're starting to lose faith, which I know can happen. Let's see, I'm going to go back to our Q&A. Yes, Diana is asking where to get the referral form that the doctor needs to sign. That would be for Helping Hands. So here I'm on the HFA Helping Hands landing page. There's a button up here for each program. So if you're applying to emergency assistance, again, you can't refer yourself, but your referrer would go here and open the referral form and fill that out. If you're applying for a different program, say items assistance, you can apply yourself. Again, here's Helping Hands referral form. You would click that and start your referral, and then we have hyperlinked here the form that you would need. So again, trying to make it easy. Your healthcare provider can even fill this out online and save it as a PDF. So we are trying our hardest to make everything as easy as possible for you all. Any more questions that are specific? I can keep walking through some examples, but I would love to show you what is most relevant for you.
So Allison, there was a question about, do you help with purchasing a new vehicle?
That's a great question. So we actually can help with that. We have had situations through emergency assistance where someone needed, maybe their car got totaled, and so there weren't really repairs that could be made, and they needed their vehicle in their area to be able to get to appointments and jobs, things like that. So we can consider that under the transportation category through emergency assistance. Keep in mind, our maximum is actually $750 for emergency assistance. So we would only be able to cover part of that cost. You know, that's a situation where we would be having a conversation with the applicant about what is the most useful way to use our program. You know, we're being good stewards of our program. We're doing what makes the most sense, that would make an impact for the applicant and would be sustainable for them.
Great, and kind of a follow-up to that, would you reimburse for taxi rides in the interim between vehicles?
So if a person had an active inhibitor and they had to take a taxi to their appointment, first I would say for any medical transportation, talk to your healthcare provider first. A lot of HTCs and other hospitals have programs that will cover transportation to your doctor. Same if you have Medicare or Medicaid, there are reimbursement or transportation options available there. So check out those first. But if you know that you're not going to be able to get to your appointment for an inhibitor, you're not finding other resources, let us know. I would hate for you to take an expensive taxi ride thinking you could get reimbursed and then it not end up being something we could cover. But we do have some medical travel assistance available through inhibitor support.
And there is another question, actually a couple more that came in. Do you cover the cost of medic alert bracelets?
So yes, we can, through our items program, cover the actual jewelry. We don't cover the service, like a medical alert service, unless it is specifically recommended by your healthcare provider. I would also say that NORD recently started a partnership program with Medic Alert. That might be something to look into. And again, if I can take us back to the patient assistance portal, medical items is a category on here. Here's NORD's Medic Alert program. So that's something to look into. That comes with a 3-year membership if that's the level of support that you need. But we do cover medical alert jewelry.
Here's another. Are there programs to cover hotel and meal costs for treatments that require an overnight stay?
So that, again, would only be through our inhibitor support program. And you can read more about that on our website. Here's our inhibitor support page. So I would encourage you to look at that. Also, again, check with the organization that you have your appointment with. And once again, back to my patient assistance portal, medical travel is the next category on here. Some really good resources here that might connect you with a free or reduced cost place to stay, if that's what you need.
And then we probably can do one more. Someone asked, where does the money for Helping Hands come from?
Oh, that's a great question. And also an opportunity for me to ask you a question. Thanks for throwing me that question, person. So our funding comes from generous organizations, some of whom are sponsors for the symposium. So large grants from organizations, Novo Nordisk is one. I'd love to give them a shout out for supporting Helping Hands. It also comes from people like you. We have several ways that community members can support Helping Hands. You can join Team Resilience. We're about to have the Disney race. So if running or sporting, bike riding is your thing, check out Team Resilience to help fundraise for Helping Hands. And if you go to hfasymposium.org, right at the top of your screen is a donate button. And by clicking that donate button, you can help support people who really need it. I cannot overstate the impact that Helping Hands is having on people's lives, especially this year. Even if you give $5, I'm telling you that it's going to go to a good place. We are keeping people's lights on. We are keeping people in their homes. We are helping people get their car fixed so that they can get a job after they've lost one from COVID. Please, if you do have the privilege of having some extra dollars, they would be going to a good place. And I know I'm biased, but just thinking about all the people I've talked to this year who've benefited from that support.
Well, thank you. We are at the end of our time here. Is there anything else you wanted to mention or needed to say before we wrap up?
Thank you. I just appreciate all of you for joining this session. And I hope that you will go on our website, get familiar with our resources. Sometimes it's nice just to know what is there in case you or someone else needs it. And you can reach us at helpinghands@hemophiliafed.org. You can reach our services team. That's the best way to reach us if you have a question. So thank you so much. And I'll turn it back to you, Janet.
Great. Thank you, Allison. That was really, really excellent. Great information and great resources. So before we close tonight, I just want to remind everybody there will be an evaluation that will pop up at the end of this session. So please take some time and fill that out. If you want to be considered for the drawing, our daily drawing, you will need to add your name to the end of that evaluation form. And then also please come back tomorrow evening. It is promising to be an evening of excitement and fun. So get in your comfy jammies, and we hope you spend the final night of symposium with us. We're looking forward to welcoming everybody in for the final night. It's been a great week, and we're gonna cap it off with a great party at the end. So thank you again to Allison for this wonderful presentation. Thank you all for joining us this evening. We hope you have a great rest of your night. Take care, everyone.